Hi, dear friends. A very warm welcome. Thank you so much for joining this course of arresting myopia progression. I was really skeptical at the beginning whether this would be, really successful or not. And to my utter surprise, within 4 days, we could generate all of you together on this board. So a very warm welcome towards generating all this buzz against myopia and to learn what we can do to flatten the myopia curve. This is my first batch. This will start from May 2025. We have done this workshop, on-hand workshops, physical workshops, but this is for the first time I'm venturing into online workshops, and I think online has a better reach because we can sit comfortably, discuss, talk, go back to our clinics and find out what more we can do. It would be a good learning exercise for me also. So the plan at this point of time is that we would be sending a video every 10 days. We will be sending a YouTube link from where you can see the video. This will be a private link and will work only from your email which you have given. Then after 4 5 days, we would be sending you a link for Google Meet on which we will see the same topic and we will discuss what we have seen in the video, what more can be discussed. We can raise questions, take doubts, and whatever I have missed in the videos, we can go back and discuss. We can record that particular meeting also for a repeat of what we have discussed on and what points we have forgotten. So that is regarding how we will be doing it. After 9 such videos and talks, we will do a small evaluation as to what we have learned, what we have understood. There is a peripheral refraction aid which I designed mainly because there was nothing available for a private practitioner when we want to do peripheral refraction. I'm sure there will be a class when we will discuss this peripheral refraction in detail and how it helps in discussing, in giving, in prescribing peripheral defocus lenses. But the device, we have already finished the last design of it and it is in production. So I'm happy to announce that we would be sending you this as a complimentary gift for joining us on board. And this we will courier you. We will take the addresses and send it to you. And also we will be sending you a video as to how to set it up, how to use it. We will be showing you. So that was regarding peripheral refraction aid, and bulk of the meetings will be on Google Meet. So these are the basic topics on which we will be talking about. The first and foremost talk would be on myopia. What is myopia? We all know this. This is pretty basic, but this will set the tone as to why it is needed, what is the prevalence, what we are doing right now, and what we can do for future generations. How many patients are there? What is the money involved? How much we can have as a load in myopia control clinic? So that will be taken in myopia, the problem statement. Also, there will be a small part of the same lecture on complications of myopia, multiple levels at which myopia can affect. All of this would be around 45 minutes to 1 hour on YouTube. And then we can, after a couple of days or 4 days, we can set the tone for discussion on Google Meet. And the next important talk would be on what are the risk factors for progression of myopia. Obviously, this will be a very important talk because this would help set the guideline as to which patient should be suspected, who are the suspect myopes who would progress, who are the progressors, what is the incidence of progression, who are the patients who would need a certain kind of drugs, atropine or glasses, what should be done. So that all will be discussed in this. How to diagnose, what to document, what is progression, how much is progression, uh, how should we treat when there is progression, what is the end point of treatment, when to start, when to stop. That would be in this. I think one of the most important part as to why we are talking about myopia is pre-myopia. Uh, this is where the things should start actually. We should discuss this, how we can prevent myopia. So this is myopia. Before the myopia starts, we can see, we can diagnose these patients and what can be done in pre-myopes. Atropine has been the cornerstone with atom 1, atom 2, lamp 1, 2, 3, 4. Why atropine? How atropine is useful? What are the finer points? What is the concentration? When to start? What are the problems? How to decide? And when finally to stop it? And then there will be a talk which will be basically in three parts. The first part would be optical control of myopia, the basics of why and how these glasses came into picture, what is peripheral refraction, and how to measure it with a peripheral refractant aid, and how does it tell you whether these glasses will work or not, what is the principle of these glasses, and then there will be when to prescribe these glasses. Then second part will be on ortho K lenses, how to fit these lenses, which are the suitable patients for this. So bulk of ortho K will be on myopia control by ortho K and not really routine ortho K. We will be talking more on ortho K as a myopia control strategy. Red light therapy will be with ortho K, and then there will be a final lecture. So these are three different lectures. Each will be having around 60 minutes to 1 hour video on, and the last one is on combination therapy, how to combine atropine with glasses, which one to do first, ortho K with atropine, ortho K with red light, whether red light with ortho K can be combined, what are the advantages of combination therapy, and what could be the problems of these combination therapies. So that was regarding combinations therapies. And before we talk about setting up of myopia clinic, we will be giving a small evaluation after 9 lectures. We will be talking about evaluation, what we have learned, how we can improve further. So evaluation will be online, and then there will be a discussion as to what are the doubts which are still remaining, and then we will have a final lecture on basically about how to set up a myopia control clinic, what are the challenges, what are the monetary benefits, how to generate money, what are the instruments which you would need, and likewise. So that is all regarding this particular course, and I really would like to thank you once again for joining hands with us, and let us see you on board. Thank you so much.